Dr. Moffitt, you've been tracking this data closely for months. Now we've learned 2,369 children are in hospital rooms this week getting treated for COVID. It's a new record. So why are so many kids getting sick right now?
I think there are really two major drivers of the rise in pediatric hospitalizations. And the first really has to do with the absolutely unprecedented infectiousness of this Delta strain compared to previous strains. And secondly, we know that the Delta strain's ability to cause severe infection that leads to hospitalization is really substantially impacting those who are unvaccinated. And because children are not yet eligible for vaccination under the age of 12, they make up a much bigger proportion of our population that is susceptible to severe disease. So I think those are really the factors that are driving these numbers we're seeing of pediatric hospitalizations.
So let's break that down a little bit, because you talk about the Delta variant causing more severe illness. We had kind of the thought process all along in this pandemic was that children, on the whole, were not as severely impacted by coronavirus, by COVID. So is Delta variant changing what we know about that? Are they just as, or perhaps more likely to become seriously ill?
Yeah, no, it's a great question. It's a little bit confusing to really tease some of that out, but what we know so far is that more children are being hospitalized right now, but it's not totally clear that the Delta strain in and of itself is capable of causing a higher degree of severe illness in children than previous strains have. It's that our children who are unvaccinated make up a larger proportion of that population now that is susceptible to severe infection. I think we still need more data really to be able to tease out some of those numbers in terms of how many children broadly are infected with the Delta strain right now. So we need to have a better understanding of that total number and then be able to evaluate whether the number of kids hospitalized amongst that number really suggests that Delta is causing more severe disease in children than previous strains. So I think we need a little bit more data to determine.
Well, and of course, we're talking about national numbers. Boston kids just went back to school today. Parents looking at these numbers may be concerned. So what's your message to them locally?
Yeah, my message to parents locally would be that we learned so much last year about how we can keep our schools safe. And there are no data so far to suggest that all of those risk mitigation measures that were in place keeping schools safe last year would not be effective against the Delta strain. So things like masking while people are indoors, improved ventilation at school, all of those things, if those are in place and everybody is really being compliant with those, we can keep school safe, even in the context of the Delta SARS-CoV-2 infection. And my last thing to encourage parents to do would be to take what we know about vaccination. We know that it's still possible to become infected, but these vaccines still significantly reduce the likelihood of becoming infected and the possibility of infecting others. So parents should be encouraging everyone who spends time with their child who's eligible for vaccination to do so if they've not already.
All right, Dr. Kristen Moffitt with Boston Children's. Dr. Moffitt, good to see you. Thanks for your time and insight.
Sure, good to see you too.